Have you ever wondered about the silent killers lurking in your everyday life? We all know smoking's bad news, but what if I told you some of the biggest risks for pancreatic cancer are hiding in plain sight, and you probably never connected the dots? Let's dive into the world of pancreatic cancer risk factors that might surprise you. First up, chronic pancreatitis. It's not just a fancy medical term. It's a serious condition that could be setting the stage for something far worse. Imagine your pancreas, that hard-working organ, constantly inflamed and irritated. That's chronic pancreatitis in a nutshell. But here's the kicker. This long-term inflammation isn't just painful, it's potentially dangerous. Studies show that people with chronic pancreatitis have a significantly higher risk of developing pancreatic cancer. It's like your pancreas is sending out an SOS. But are you listening? Now, let's talk about diabetes. You might be thinking, what does diabetes have to do with pancreatic cancer? Well, buckle up, because this connection might blow your mind. A sudden diagnosis of diabetes in an adult with a healthy weight can sometimes be more than just diabetes. It could be an early warning sign of pancreatic cancer. But wait, there's more. The relationship between diabetes and pancreatic cancer is like a complex dance. Sometimes, diabetes increases your risk of pancreatic cancer. Other times, pancreatic cancer can actually cause diabetes. It's a two-way street that researchers are still trying to fully understand. So, if you or someone you know has been recently diagnosed with diabetes, especially if it seems to come out of nowhere, it might be worth having a deeper conversation with your doctor. Let's shift gears and talk about something you can't change but absolutely need to know about: your family history. We're not just talking about one relative who had pancreatic cancer. We're talking about a bigger picture. Did you know that certain genetic syndromes, like BRCA2, the same one associated with breast cancer, can significantly increase your risk of pancreatic cancer? This is why knowing your family history is crucial. It's not just about your immediate family. Aunts, uncles, grandparents, they all matter. If pancreatic cancer seems to run in your family, or if you have a history of certain genetic syndromes, you might want to consider genetic counseling. Knowledge is power, especially when it comes to your health. Now, here's a curveball for you: gum disease. Yes, you read that right. Emerging research is exploring a surprising link between certain oral bacteria and pancreatic cancer. It turns out that those twice-yearly dental checkups might be more important than you ever realized. Scientists are finding that some bacteria associated with gum disease might play a role in the development of pancreatic cancer. It's not just about having a pretty smile. Good oral hygiene could be a key player in preventing one of the deadliest cancers out there. So, next time you're tempted to skip flossing, remember, you're not just fighting cavities, you might be fighting cancer too. Let's talk about age for a moment. Did you know that most cases of pancreatic cancer are found in people over 65? It's not to say younger people can't get it, but age is definitely a factor to keep in mind. As we get older, our risk increases. It's just another reason to stay vigilant about our health as we age. But it's not just about getting older. A history of other cancers can slightly increase your risk of pancreatic cancer too. It's like your body's keeping score, and previous battles with cancer might make you more vulnerable to this particular fight. Now, I know we've covered a lot of ground here, and some of it might seem scary. But remember, knowledge is power. By understanding these hidden risks, you're already taking a huge step towards protecting yourself and your loved ones. So, let me ask you, which of these hidden risks was most surprising to you? Was it the link with gum disease, the complex relationship with diabetes, or maybe the importance of knowing your family history in detail? Here's what I want you to do next. Share this video with someone who needs to know. It could be a family member, a friend, or even your dentist. They might find that gum disease link particularly interesting. The more we spread this knowledge, the more lives we can potentially save. And if you're hungry for more life-saving knowledge like this, don't forget to subscribe to Pancreatic Cancer Warriors. We're here to arm you with the information you need to stay healthy and aware. Remember, pancreatic cancer might be a tough opponent, but with awareness and early detection, we can fight back. It's not about living in fear, it's about living smart. So, keep an eye on those hidden risks, stay proactive about your health, and never underestimate the power of knowledge. Let's recap what we've learned today. Chronic pancreatitis isn't just painful, it's a potential precursor to pancreatic cancer. A sudden diabetes diagnosis could be more than it seems, especially in adults who are at a healthy weight. Your family history matters more than you might think, with certain genetic syndromes playing a significant role in pancreatic cancer risk. And who would have thought that something as simple as gum disease could be linked to such a serious cancer? It just goes to show that every aspect of our health is interconnected. Don't forget about age. As we get older, our risk increases, and a history of other cancers can also slightly bump up our chances of developing pancreatic cancer. But here's the thing. Knowing about these risks isn't meant to scare you. It's meant to empower you. Armed with this information, you can make better decisions about your health. You can have more informed conversations with your doctor. You can be more vigilant about symptoms that might otherwise slip under the radar. Think about it. How many of these risk factors apply to you or someone you love? Maybe you've had chronic pancreatitis and never realized its potential long-term implications. Perhaps there's a history of pancreatic cancer in your family that you've never really thought about before. Or maybe you're in that over 65 age group and realizing it's time to pay closer attention to your pancreatic health. Whatever your situation, the key is to stay informed and proactive. Don't wait for symptoms to appear before you start thinking about pancreatic cancer. By then, it might be too late. Instead, use this knowledge as a shield, a way to protect yourself and catch any potential issues early. And let's not forget about the power of lifestyle choices. While we can't control everything, there are things we can do to reduce our risk. Maintaining a healthy weight, eating a balanced diet, staying active. These aren't just good for your overall health, they could be crucial in preventing pancreatic cancer too. So, what's your next move? Maybe it's scheduling that dental checkup you've been putting off. Or perhaps it's having a conversation with your family about your health history. It could be as simple as making a commitment to floss every day. Your dentist will thank you, and your pancreas might too. Whatever you choose to do, remember that you're not alone in this fight. There's a whole community of people out there, doctors, researchers, survivors, and advocates, all working towards the same goal, beating pancreatic cancer. By staying informed and spreading awareness, you're joining that community and making a difference. Before we wrap up, I want to leave you with one final thought. Pancreatic cancer might seem like a formidable enemy, but knowledge is our greatest weapon. Every piece of information you learn, every risk factor you become aware of, is another tool in your arsenal. So keep learning, keep asking questions, and most importantly, keep sharing what you know. Together, we can shine a light on these hidden risks and potentially save lives. So, are you ready to join the fight against pancreatic cancer? Share this video, spread the word, and let's make pancreatic cancer a thing of the past. Remember, awareness is the first step towards prevention. Stay informed, stay healthy, and keep fighting the good fight.